Ma'am, you can start.
Hi everybody, welcome back to this class on CNS depressants and psychotropic drugs. I'm your forensic medicine and toxicology educator, Dr. Prashi Kaveri. And today we'll be discussing about long essays and short essays. And under long essays, we'll be discussing about methyl alcohol poisoning. And we'll also be discussing about barbiturate poisoning and how we need to approach a question of barbiturate poisoning when it is asked for 10 marker. Apart from this, in short answer, we'll be discussing about ethyl alcohol poisoning, delirium tremens, chronic opium poisoning, and treatment for the same, McKeown sign, knockout drugs, chloral hydrate, flashback phenomena, and LSD. Under LSD, we'll be discussing about signs, symptoms, and even treatment. Now, coming to what Auricle has to offer all the students who are using it. One, the recorded videos. So, recorded videos can be used for the students to watch all the videos at the comfort of their home or wherever they are in. And they can rewatch it any number of times whenever they feel like they're missing out on any topic. Coming to live classes, these are curated in such a way that all the important questions from last 10 years are covered so that it gives a hand to students regarding how they need to approach these questions and what are the anticipated questions that can come in the present exam. Coming to practical sessions, they cover the bridge between when actually practical sessions happen in college as and even when the students will be going and giving their actual practical exams. So there is a considerable time gap here, and to bridge it, Oracle has come up with practical sessions where live videos will be shown as to how you need to approach it, even giving you a good idea about Viva OC. Coming to exam modules, this is curated to cover each subject in less time so that you're taken care of and it is easier for you to revise. Coming to hard copy books, one can use this in order to save time. You can highlight all the important points. That way, it will be easier for you to revise also. Coming to the recorded classes, the other things that it has to offer are the flexible learning, and all the educators here will ensure that you understand the subject in depth and do not miss out on anything. Also, it is going to be very convenient for you to revise because you can use it to revise at the comfort of wherever you are in. In the live classes, in-depth knowledge of all the previous 10-year questions are going to be given just before you go and give your exams so that you'll be very thorough of all the anticipated questions coming to your recent exam. Coming to the expert exam module, it is going to teach you answer writing skill. A lot of students, even though they know about a subject in depth, they aren't able to score enough marks because they do not know how to put those in paper. So under express exam module, the educators are going to tell you about how you need to put all that you know in paper. Coming to images or flow charts or writing proper points, this is where this platform is going to help you. And there is also one-to-one doubt clearing session. These are curated in such a way that there is a student-centric approach and every student gets a personalized attention. There is going to be a safe learning environment where students can clear all your doubts and become very concrete in the subject. Hard copy notes are going to be a time saver, as I told you, and it's also going to give you in-depth coverage of all the points. And also there is going to be a lot of flashcards and images that you can use to build on your photographic memory. And the question bank is curated in such a way that there are 3 levels. You can go from basic up to the expert level. And once you reach expert level, there is no boundary. You have already mastered the subject. And in practical sessions, you're going to get hands-on experience about all the things that are going to be there in your practical, as well as you're going to get a fair insight as to what will be asked in the Viva OC of each and every subject. Coming to the subscription plans that Oracle has to offer, there is going to be foundation plan, advanced learning plan, complete learning plan, and the last one is going to be ultimate MBBS plan. Under the foundation plan, which is there for 3 months, you're going to get pre-recorded classes, live classes, exam module, practical sessions, and QBank. Coming to the last two, whereas in the complete learning plan and the ultimate MBBS plan, you're also going to get hard copy notes and one-to-one doubt clearing session. In the ultimate MBBS plan, you're going to be covered through and through from your first year of MBBS until next 4 years. Now, coming to the topic per se, we'll be discussing about CNS depressants and psychotropic drugs. So both of these are the topics from toxicology. And these, apart from coming as questions in your exam, has various implications in your day-to-day life. So let's dive in and look at what questions are there. Coming to the first question, And a long answer, we have methyl alcohol poisoning. We need to explain about the signs and symptoms, the fatal dose, as well as post-mortem findings. Now, coming to fatal dose, it is actually not that easy to remember fatal dose of each and every drug, but then there are certain important topics where you need to know. And methyl alcohol poisoning is one such topic where fatal dose has to be known by every student. And in methyl alcohol, you need to also one more similar thing to methyl alcohol is ethyl alcohol, right? In both of these, you need to also know about the safe limits. For ethyl alcohol, you need to know what is the safe driving limits as to how much blood alcohol can be there in a person and when till when he can drive. Now, coming to the question per se, initially you need to write about a description as to how methyl alcohol will look. It is going to be a colorless volatile liquid and it has odor similar to ethyl alcohol. The most common scenario for a poisoning with methyl alcohol is that people mistake it to be ethyl alcohol. So many people want to get drunk, no. So whenever they see methanol and it smells like actual alcohol, instead of checking thoroughly whether it is alcohol or not, they just think it's alcohol and consume. This is the most common scenario for a case of methyl alcohol poisoning. Now, coming to signs and symptoms, all these are similar to the normal alcohol poisoning. That is, there is in CNS there is going to be delirium. Delirium is the most prominent sign here. Apart from this, the person's all the good manners are lost. He is not able to take the judgment wisely. He can see floaters in front of his eyes. He may not be able to see all the things clearly. Plus, he also has that spinning sensation in his head. And there is also going to be high anion gap metabolic acidosis. So high anion gap metabolic acidosis, also called as HAGMA, is common not only here but also in case of any poisoning with either ethyl alcohol or salicylic acid, anywhere, whichever drug is acidic. Whenever a person, suffers from poisoning from all these acidic drugs, he's going to suffer from HAGMA. So coming to the visual disturbances, he's going to have photophobia, blood vision, snow field vision, followed by sudden failure of vision and complete blindness. That is, he won't be able to see any objects. And finally, if the optic nerve is damaged, it can also result in optic neuritis. Now, coming to the fatal dose, it is around 60 to 200 ml. And the fatal period is going to be 24 to 36 hours. That is, it is going to be 1 day. Coming to the treatment part, gastric lavage will be done with 5% bicarbonate solution, after which activated charcoal is given. So activated charcoal is given so that the further absorption of methyl alcohol doesn't occur in the body. Also, ethyl alcohol, which is the actual alcohol, can be given as an antidote. When this ethyl alcohol is given IV as a 10% solution, you have to start it as an infusion where you'll be loading 500 ml. It competitively blocks the formation of formaldehyde, allows the less toxic methyl alcohol to be excreted unmetabolized. So what happens is that normally whenever there is methyl alcohol, whenever it gets metabolized, formaldehyde is formed. So formaldehyde is the actual culprit. This is going to cause all the ill effects of a methyl alcohol poisoning. And whenever you substitute methyl alcohol with its antidote ethyl alcohol, it is going to compete and block all the enzymes which would result in formation of formaldehyde. That's why the actual methyl alcohol will get excreted from the body as it is. Actual methyl alcohol is not that poisonous, only the metabolites are poisonous. So when you block the formation of metabolites, all the ill effects can be curbed. So coming to the other treatment methods that can be followed, you can give formipazole. So formipazole is a competitive inhibitor of alcohol dehydrogenase, same mechanism. So the methyl alcohol remains unmetabolized and it can be easily excreted from the body. You can also give folic acid and folinic acid for treatment. You can also give crystallite therapy, where it's a combination treatment with dextrose, thiamine, and phosphate. So these are going to replenish everything that is lost from the body. Like whenever you give thiamine, a vitamin D is going to get replaced, and phosphate also helps in production of energy. That way, the person, doesn't go out of energy. Also, this crystallite therapy is also the treatment for the ketoacidosis. Whenever the person has taken so much alcohol that his life saving would be the major goal, hemodialysis has to be tried so that faster recovery can be sought in the patient. Also, symptomatic treatment for any other problem like breathing, airway, or circulation should be taken care of. Also, if the person is very dehydrated, fluids is to be given to the person. Now, let's see what is the post-mortem appearance in a person who has died by consuming methyl alcohol. As I told you earlier, methyl alcohol poisoning occurs because people mistakenly think that methyl alcohol is a normal alcohol and then they consume it. So first it is going to be cyanosis in the mucous membrane of stomach and duodenum. So in the GIT, when they cut open, it is going to look very cyanosed. And in the small and large intestine, it is going to be very contracted, resembling a thick pipe. So the soft intestine is going to look like a rigid pipe. And coming to lungs and brain, it is also going to be congested with local hemorrhages. Remember, whenever a person is suffering from poisoning, be it alcohol poisoning or any other corrosive poisoning, always, if you do not remember what to write under postmortem appearance, remember congestion is the key thing that you have to write for each and every organ. And extra things like, for example, fatty change isn't seen in all the poisoning, but in methyl alcohol poisoning, fatty change is going to be seen. And kidney tubular degeneration is going to be seen in the kidneys. Now, coming to the second question, here we'll be discussing about what happens in case of barbiturate poisoning. Now, coming to barbiturate, what are barbiturates? So, barbiturates are the white crystal substances which are odorless and they are found in the form of powder. Now, coming to the signs and symptoms of barbiturate poisoning, the first symptom would be drowsiness. Later on, when the person takes large doses of barbiturates, he can have confusion, excitement, delirium, and hallucination. Later on, he can also develop vertigo, slurred speech, and even headache. And after all these CNS manifestations, the next thing that is seen in the patient would be visual disturbance. And at the last stage, when the amount of barbiturates that he has taken is so much that his body cannot take it anymore, then he will slip into a very deep coma. Now, coming to other signs and symptoms, coming to all the reflexes, there is going to be inhibition of superficial as well as deep reflexes. That is, if you try to elicit any reflex, like for example, a knee reflex, you won't see it. Babinski sign is positive. So what is Babinski sign? If you take a sharp object like a key or a pen, for instance, and if you stroke from the lateral aspect of the foot up to the great toe, there is going to be dorsiflexion of all the digits, right? So in this person, that is going to be seen. This is nothing but positive Babinski sign, and it can also be seen in deep sleep and in children. It is going to be positive. So there is going to be dorsiflexion and fanning of all the digits. There's also going to be fall in the cardiac output, because of which there is the cardiovascular collapse at the later stages, and the respiration becomes irregular. It is called as Cheyne-Stokes respiration, where it is going to be like this. This is going to be the pattern of Cheyne-Stokes respiration. And finally, it happens for a couple of cycles, and then finally the respiration is going to cease. Apart from this, coming to the skin manifestation, there are going to be blisters all over the skin and there are going to be areas of erythema. And finally, death could occur either due to respiratory failure or because of ventricular fibrillation. So remember, the cause of death is either a CVS cause or a RS cause. Now, coming to the treatment part, what can you do when somebody comes to you with barbiturate poisoning? Firstly, you need to look at the patient, evaluate and secure airway, breathing and circulation. Apart from that, you have to give a gastric lavage with potassium permanganate. This is done so that you prevent the further absorption of barbiturate into the body. There is no specific antidote, so all the treatment that you're aiming here is just symptomatic to aim at bettering the person's condition. There's something called a Scandinavian method, which uses anti-shock measures and it also maintains patent airway and adequate respiratory support. Here, respiratory support is maintained because, as I told you, the cause of death would be a RS cause mainly. That's why you're trying to take care of it. And the method that is used to take care of RS is called a Scandinavian method. Apart from this, you can give normal saline with 5% glucose. And when you give it, it increases the rate of excretion of barbiturates from the body. The other treatment methods, the symptomatic treatment methods, include artificial respiration with oxygen. You're going to give 100% oxygen so that the person doesn't die out of bronchospasm. Bowel is evacuated using enema. Also, you give hemodialysis when the patient has ingested so much barbiturate that you suspect that the patient might die out of barbiturate coma. That is when you plan the person for hemodialysis. Also, you can give forced alkaline diuresis. This is also helps easy excretion of barbiturate from the body. Now, coming to what is seen in the post-mortem of patients who die out of barbiturate poisoning. Remember that there are no characteristic signs that are seen in the post-mortem of these people. There will be some signs of asphyxia as well as cyanosis. Remember, in the previous question, I told you that in most of the poisoning by either alcohols or corrosives, cyanosis is going to be a major sign. So remember to put it in cyanosis in each organ system. Now, for example, if post-mortem appearance of a barbiturate poisoning was asked as a three marker, there wouldn't be that many points that you can actually write. So you write each organ system and write cyanosis. So in cyanosis, what else can you see? You can see subpleural effusions. You can see petechial hemorrhages. You can mention those so that those will be the extra points for your questions in the answer. Also, lung, stomach, pleura, and pericardium are also going to look congested. One and the same. Now, let's come to the shots. The first question would be ethyl alcohol poisoning. So, what is ethyl alcohol poisoning? This is nothing but the normal alcohol poisoning, and the normal alcohol is nothing but ethyl alcohol. What are going to be the symptoms? So, initially, there is going to be a stage of excitement, and stage of excitement is seen when the blood level of persons, when the alcohol levels in the person is going to be 50 to 150 milligram per 100 ml of blood. There is going to be increase in confidence in the person. The person loses self control, the normal good manners are forgotten. Also, there is something called as alcohol-based nystagmus. So, what is nystagmus? When a person tries to fixate his vision on something, there's going to be movement in his eyes. It can either move right or left, or it can go up and down. So, this is called nystagmus. So, whenever the person drinks alcohol in the initial stages, nystagmus can be precipitated in the patient or in the person, and this nystagmus is called as alcohol-based nystagmus. Also, there is going to be poor mental coordination where he isn't able to clearly think and execute whatever he is thinking. The next stage would be stage of incoordination. This happens when the blood level of alcohol reaches around 150 to 250 mg per 100 ml of blood. Here, the person is going to be carefree, cheerfree, very irritable. He's also going to be excitable and quarrelsome. He tends to pick up quarrel for very petty matters here. And also there will be clumsiness and incoordination of fine and skilled motor movement. Like for example, if the alcohol level is this much, if you ask a person to separate colored balls or pick up a small item, very fine movements, there is going to be incoordination in all these moments. Coming to the third stage, it is nothing but stage of coma. This occurs when the blood alcohol level reaches more than 300 milligram per 100 ml of blood. Person's speech is going to be slurred. Also, there is going to be incoordination of the major motor activities. Like, for example, if the person has to drive, he isn't able to clearly judge about his driving. That is why the blood alcohol level for driving is kept as less than 30 milligram per deciliter. Now, coming to the treatment in case of alcohol poisoning. Firstly, you try to evacuate the stomach and bowel so that further absorption of alcohol doesn't take place into the body. And patient is also kept warm. You give the patient fructose so that it acts as a source of energy, as well as it will also promote alcohol metabolism so that he can be brought to his normal states at the earliest. Also, you can give 1 liter of NS with 10% glucose. It is because he'll be dehydrated and too much alcohol takes in all the water from his bowel and he is going to be dehydrated. That's why you give him NS along with 10% glucose so that he'll be energized also. Along with it, he can be given 100 milligram of thiamine because whenever a person drinks too much, the thiamine reserves in his body is going to be depleted. So you also have to give thiamine to these people, and you should also give insulin because whenever you are giving this much glucose to maintain its blood level, you have to also give insulin, or the sugar level in the patient can spike up. Also give artificial respiration if the person has problem with breathing or if his SpO2 is decreasing. And hemodialysis can be tried as a last resort when nothing mentioned above works or if the blood alcohol in this level in the person's body is like more than 500 ml per 100 ml of blood, then you can also try hemodialysis. Now, coming to the second question, it is about delirium tremens. So, what are delirium tremens? These are the severe form of alcohol withdrawal that can be seen in people who are used to drinking very heavily, and if they try to suddenly stop the intake of alcohol, in them we can see something called as delirium tremens. That's why in any rehabilitation center, they advise the patient to not stop the alcohol suddenly and to gradually cut down on the amount of alcohol the person drinks. Now, what is seen in a person who has delirium tremens? Number one, the symptoms could be confusion, agitation, and hallucination. So under hallucination, it can be either visual or auditory or tactile. That is, he can feel like he is seeing floaters of light or hearing some voices when they do not exist in the real, or it could be tactile. That is, he might feel like some insects are crawling on him, something similar to Mudman syndrome. Such things can be seen. Also, the person can experience seizure, tremors, and autonomic instability, where the heart rate shows variation, his blood pressure could show variation. Also, he can have episodes of fever. Now, coming to when is the onset of delirium tremens? Delirium tremens usually develop 40 to 72 hours after the last drink. That is, it develops within 2 to 3 days. So, whenever there is an MCQ exam, this would be a cleanser. Um, if a question about alcohol withdrawal is given, and if they say that all these symptoms arise within 2 to 3 days, then the probable answer could be delirium tremens. Now, coming to the risk factor, the one of the risk factor is nothing but long-term heavy alcohol use. And if the person has tried quitting alcohol prior, and if he had similar episodes, then even this time when he's trying to quit alcohol, something similar could happen. And also, if the person has liver disease, in them, this thing can be precipitated. Also, coming to what is the treatment of delirium tremens, it is nothing but hospitalization, and you sedate the patient, because as I told you earlier, most of the symptoms are CNS symptoms where you can see seizures, tremors, and agitation. So, in order to calm all those down, you need to sedate the patient. You can use benzodiazepines to sedate the patient. Also, you can give supportive care to take care of all the other symptoms. Mortality can be seen in around 35% of the cases, and this is seen when proper medical attention is not sought for. The third question is on chronic opium poisoning. What is the treatment? The treatment for chronic opium poisoning, initially it would be stomach wash. So, as I have told you n number of times, you do stomach wash so that all the remaining unabsorbed poison from the body gets excreted and further absorption doesn't take place. That should be your number one treatment whenever a case of poisoning comes, except for certain things like kerosene or any other hydrocarbon poisoning. You can also give activated charcoal so that whatever opium is there in the GIT get absorbed onto the activated charcoal and hence will not go into the circulation. Emetics was tried earlier, but it is not of much use because there is always a risk of aspiration, therefore avoided. Intestines cleared with enema to prevent further reabsorption. Also, you have to establish adequate airway and you have to intubate the person if you cannot keep up the SpO2 above 94%. The other treatment methods that can be tried are, you can also give naloxone. So naloxone is a specific opioid antagonist which will compete with the opioid and it will go and act on the receptor side. So most of the systemic effects of opioid can be prevented or can be reversed by giving naloxone. And something similar to naloxone is nothing but nalmefene. It has longer duration of effect than naloxone, so a better one, but little on the expensive side. So naloxone is used mostly, and naloxone is also easily available, which warrants its use in most of the cases. You can also give physostigmine, and physostigmine is given to reverse all the respiratory signs of depression. And as I told you, symptomatic treatment. So symptomatic has to be mentioned in any question because you have to always take care of airway, breathing, circulation, and if the person is dehydrated, then you also should correct the fluids. So symptomatic should be written in any question of poisoning when it comes to treatment pattern. Coming to the next question, it is about the McEwen sign. So what is McEwen sign? It is a sign that is found in those people who are chronically using alcohol. So it is nothing but a perioral hyperpigmentation or a darkened ring around the mouth that may develop in individuals with chronic alcohol use. So it is, if this is the mouth, it is going to be seen here, just around the mouth. It is perioral. It's a ring-like thing. It's a hyperpigmented patch. What is the cause of this discoloration? Uh, Researchers say that it is because of the result of recurrent skin irritation. Because whenever the person, alcohol is not a very soft thing to take in, right? So whenever the skin around the mouth gets irritated because of consumption of undiluted alcohol, the skin gets irritated. Also, there could be nutritional deficiencies like vitamin B deficiencies. For example, thiamine deficiency. Thiamine is used for the metabolism of alcohol in the body. So when thiamine is used, its reserve get over, and there is deficiency of thiamine. So due to these things, the patch of discoloration develops around the mouth. Also, the hyperpigmentation often appears around the mouth, but may extend to other areas of the face, such as cheeks, in chronic alcohol consumers. Now, coming to the association of this patch along with alcohol, it happens in those people who tend to, be drinking alcohol from a very, very long term, all these heavy alcohol users, and in individuals who have poor nutrition. Because alcoholics, by default, all your nutrition reserves are going to be less. Apart from this, if your diet is not good, that could be one of the causes for developing McEwen's sign. Other reasons would be malabsorption, so that there will be vitamin deficiency, also chronic liver disease when alcohol cannot be metabolized properly. So all these are the causal factors for development of McEwen's sign. Now, what is the diagnostic importance of McEwen's sign? So it is a subtle clinical marker that can indicate chronic alcohol consumption. That is, when somebody with this sign walks into your OPD, you, by looking at the patient, you can say that the person has been indulging in chronic alcohol consumption. That is when this sign develops. And when you see such a sign, it also indicates to you that you might have to ask the patient to get other tests like the nutritional reserve test and even the liver function test. Now, coming to the next question, we will discuss about what are knockout drugs. So, the knockout drugs, as a word suggests, knockout. What is knockout? Knockout indicates nothing but unconsciousness or incapacitation, where the person is going to lose temporarily his control over his physical and mental sense. So, there are certain drugs that are used as knockout drugs by people who want to kidnap somebody, or as a date rape drug. For example, one is called as a rohypnol. So, the other name for rohypnol is nothing but flunitrazepam. This is often referred to as date rape drug because this is the most commonly exploited drug for the date rape cases. Here, what happens? The patient later on is going to complain of memory loss and sedation. So, if somebody mixes this compound called as rohypnol in your drink and gives you, you are going to have memory loss, and you aren't going to remember what happened here after that for another 6 to 8 hours. That's why it is called as date rape drug. Coming to the next one, it is called as GHB, the full form being gamma hydroxybutyrate. It is also a CNS depressant that can cause drowsiness, dizziness, and amnesia. That is, along with it making you feel drowsy, you're also going to have amnesia. That is, you do not remember the incident. The other drugs include ketamine and benzodiazepines. Ketamine is used as an anesthetic in medical settings, but in larger doses or recreationally, it may cause dissociation and sedation. So, you might be knowing that ketamine causes something called as dissociative anesthesia. So, what is dissociative anesthesia? That is, if ketamine is used as an anesthetic agent, the person feels like he is detached from this world. He is flying around the world in an aeroplane, or he's gone to space. Such effects are seen whenever ketamine is used as anesthesia, and that is a pleasant thing. No, that is why it has become a drug of exploitation, and also it is used as a knockout drug. Coming to the next one, benzodiazepines. They can be used to relax and sedate the individuals, and in higher doses, they can also cause unconsciousness. So, what are the four drugs that are there under knockout drugs? One is going to be rohypnol. You cannot tend to forget the name of this drug. The next one would be gamma hydroxybutyrate. The third one, ketamine, and the last one, benzodiazepines. Now, coming to the next question, we'll discuss about chloral hydrate. So whenever a 3 marker is given and they do not mention anything and just the name of the drug, you need to write about the signs and symptoms and about the treatment. So because this is what the examiner will be expecting from you. So coming to chloral hydrate, let's see what are the signs and symptoms in case of poisoning with chloral hydrate. All the symptoms are going to be similar to that of barbiturate because the chemical structure of chloral hydrate and barbiturate is the same. And the second question that we discussed today was barbiturates, right? There is going to be nausea and vomiting, also burning sensation in the mouth and the digestive tract, the esophagus, stomach, everywhere the person is going to have burning sensation. And rarely, when the amount consumed is too much, the person can also present with signs of jaundice, that is a little later sign. And also there could be idiosyncratic rash as a side effect that is seen on consumption of chloral hydrate. Now coming to the treatment. You have to give stomach wash with alkaline solution because chloral hydrate by itself is acidic. So whenever you give an alkaline solution, it will be easier for the person's body to excrete it unchanged. You can also try forced diuresis so that there is easy excretion of chloral hydrate from the body. And also the antidote is going to be flumazenil. This is the point that you have to keep in mind. Flumazenil is an antidote in case of chloral hydrate poisoning. Coming to the post-mortem appearance, congestion would be the major feature. Coming to gastric mucosa, it is going to be very soft, red and eroded. And coming to other internal organs, the major ones being brain and lungs, will also show features of congestion. Now, coming to the next question, it is about flashback phenomena. So, what is flashback phenomena? So, flashbacks are a phenomena experienced by some individuals who have used LSD. So LSD is a drug that is mostly exploited, especially in youth of today. And one of the side effects seen with case of LSD intake is nothing but flashback phenomena. Now, what is flashback phenomena? It is a very unpredictable occurrence, and it comes without warning. That is the person after taking LSD, he might be very normal for some days, and it can just show up sometimes days, weeks, and even months after using LSD. So for these time before this flashback phenomena is seen, the person is going to be completely free of any symptoms. He's going to be very, very normal. Then there are going to be sensory distortions when this flashback phenomena occur. So what type of sensory distortion are seen? There could be either visual or sensory distortion, which is similar to those experienced while on drug. So whenever a person takes LSD, he might have very colorful or distortion, sensory distortion, like in he doing space travel or seeing very vivid music and patterns in space. So these are the sensory distortions, and these could be seen whenever this flashback phenomenon occurs. So this altered perception of colors, shapes, or even movements. It is not going to be a full trip. That is, flashbacks are typically very brief seconds. So what happens when a person is on LSD? Usually, the impact is going to last for around 8 to 10 hours. But whenever the person experiences flashback phenomena, these are going to be very brief. Brief in the sense it is going to be there just for an hour or so, like 30 minutes to 1 hour. And it is not going to be as intense as taking as having an actual LSD trip. Apart from this, there is something called as hallucinogen persisting perception disorder. This is something that has been discovered recently, and this flashback phenomena is related to this HPPD, which is also called as hallucinogen persisting perception disorder. Here, the visual disturbances and alterations in perceptions continue to affect a person long after they stop LSD. That is, whoever is suffering from this disorder, in them they are more prone to getting all these visual disturbances and altered perception for more than the actual time in which it has to actually show up. What can be the triggers for this? It could be stress and fatigue. Coming to the next question, we'll discuss about what is LSD, what are the signs and symptoms, and even treatment. Now, the previous question was in continuation with this, but they had asked you only about flashback phenomena. Here, the important thing for you to know is you had to know that it occurred in cases of LSD poisoning. If you knew this much, you could build upon answer here. Now, this question firstly is talking directly about LSD. So here we'll start with what is LSD. LSD is a colorless, tasteless, odorless compound. It is going to give you two type of trips. The trip could be either a good trip or a bad trip. In a good trip, the person is going to see vivid sensory perception, like as I told you, all the good ones, no? Like flying in the space, seeing, doing space travel, colors in space, all those. But bad trip is when he feels very lonely, he gets all the suicidal thoughts, he might feel cry, all these other signs of a bad trip. Coming to the symptoms, there could be dry mouth, sweating, the pupils could be dilated, tachycardia, that is, his heart rate is going to be very high, BP is going to be very high. You can also show tremors. There could be extreme mood changes and visual hallucination. So these are the very typical features which are seen in case of an LSD intake. He also has these sensations, as I already told you. It could be a floating feeling or sensation of seeing, smell, and hearing colors. Normally, that is his visual interpretation is going to be reversed. Colors are meant to be seen, no, but this person feels that the colors are talking to him and he's hearing colors. And smell is something that is felt by nose, no. But here he feels like he is seeing smell. Now, how is LSD commonly taken? It is commonly taken as a liquid on sugar, or it can be soaked into a bloating paper, or it can be taken in the form of capsule or even pills. The person is going to show eccentric behavior. He can also have tendency for suicide, and sometimes in the case of LSD intake, there could be a homicidal death also. That is, in a group, if a group of people have taken LSD, and imagine a majority have a good trip and one person has a bad trip, he might have a tendency to kill somebody. That is what is meant in this point. Now, coming to the treatment in the case of LSD poisoning uh, or a heavy intake of LSD, let's say, you have to always give antipsychotics because most of the symptoms that are seen in these people are the CNS symptoms. So, to calm the person, you have to give antipsychotics. Later, you can give benzodiazepines and you can also try sedation in these people. Also, you can do psychotherapy so that further intake of LSD by this person can be reduced to a greater extent. That is what we had to discuss in today's class. So, in this chapter, as I told you, most of these, apart from being the questions for your exam, are also real life scenarios where a lot of people can walk into your OPD with poisoning with alcohol or LSD or any other drug of abuse. So, knowing this topic would be important then. And thanks for watching. I hope this video was helpful to all of you and subscribe to Auricle for more such videos like this. Thank you.